to this afternoon's broadcast. Welcome to every one of us, and happy new week and happy new month for those of us that we have not seen this month. Wow, this is the third month of the year, and the days are just running as if no one is chasing them. Well, highly welcome. Anyway, today we're looking at menopausal complications, the after effect of menopause symptoms, especially when they are not handled and managed properly. Okay, you know that for every stage in life it shall come to pass. That's the truth of the matter. But coming to pass, when it passes, what is it passing into? Okay, so that's what we're looking at for menopausal complications for us as women. All right, so if you've joined me live this afternoon, you can greet. So I can welcome you to this afternoon's broadcast as we go through the menopausal complications for us menopausal women today. Okay, all right, so we're all highly welcome. I just want to start sharing. If you've joined me live, you can greet, so I can welcome you to this afternoon's broadcast. So I can welcome you to this afternoon's broadcast as we look at menopausal complication, and we go ahead and we share to every friend that we have. This topic is absolutely very important because it's being proactive for a number of women. Okay, it's actually being proactive for a number of us women, so that you will know what to avoid, what to do, how to make sure you manage yourself very well at this period. I can see a lot of people online already. Please, if you've joined me live, you can greet. Hello, Chibuzo Ada, how are you? Good evening. Excellent evening. You didn't receive any notification? Wait, let me check. Is there now on Facebook now? What happened, Chibuzo? You need to check. Make sure that you still like and you still follow me. So sorry about that. Oh, dear. All right, but you're highly welcome to this afternoon, evening broadcast as we look at menopausal complication, the after effect of not managing your symptoms very, very well. Okay, what are the after effects? But meanwhile, like I said, let's share. Join me to share to all the groups where you belong, to all the women groups where you belong. Every woman actually needs this topic, okay? And it will do you will do them good if right now you just share so that they can come up live, because some people are already having some issues that they need to talk about so that one can help them handle such things even at this period. Okay, so we're all highly welcome. Thank you for joining me. For those of us who have joined, thank you, Chibuzo, thank you, Joma, thank you, Tony, for joining me live. We're all highly welcome to this afternoon's broadcast. I just want to share where it's remaining. Let's just share out so that people can actually be able to watch us today and be able to join to share in this very good information and insightful teachings that we're going to be having this afternoon. Okay, thank you all. So let's just share what's happening. Facebook, they just keep changing things. Okay, yeah, they've given me the opportunity. All right, so let's share and greet if you've joined, so that I can welcome you to this afternoon's broadcast as we look at menopausal complications, the after effects of not managing your menopausal symptoms well, and after effects of allowing some of those things to stay and linger. And also, sometimes some people don't even know they are having any symptoms, because some people can bear pain so much and some people don't know their body. Remember, I always say you need to study your bodies. If you're able to study your body, you'll be able to know when something strange is beginning to happen, and you'll be able to know, begin to seek for solution for those strange things that you're seeing in your system. Okay, all right, so we're all highly welcome. Thank you all for joining me. Yeah, thank you, Shepney, and welcome. All right, so like we all know, menopause is one point in the life of a woman and the stage of every woman that marks the end of the productive year. When we talk about menopause, we talk about after menopause, because after menopause, a woman cannot actually get pregnant except by miracle. Okay, there are miraculous pregnancies out there. And again, there are also some kind of treatments that one can do that one can still actually get pregnant after menopause. But all these are not normal, they are not natural. Okay, so most women experience menopause between the ages of 45 to 55. That's the normal actual range. But of course, we also have what we call the early or premature menopause, which occurs between 35, 40, before 45. And also we have the late menopause, which is after 55 years old. Okay, but when we talk about natural menopausal period, when we talk about perimenopause into menopause, is between 45 and 55 years. That's when your biological aging time for menopause. And menopause is caused by loss of ovarian follicular functions and also a decline in the circulating blood estrogen levels. These are the things that actually cause menopause. And the menopausal transition can be gradual, usually beginning with changes in your menstrual cycle. That is what we call the perimenopause. And this period can be the first signs that you observe, and also it ends the year after the final menstrual period before you now say you have entered the stage of menopause. Hello, Justina Abu, how are you? Welcome. Excellent afternoon, excellent evening. Okay, so perimenopause can last several years, and it can affect your physical body changes, your emotional, mental, social well-being. It can affect every area of your life. In fact, there are some women that don't even understand what is going on with their bodies. They just go AY. They just go crazy, okay? And it's because they don't know the things that are happening to them. I've met quite a lot of women who it's like an eye-opener. That's why I'm pleading with you now. Do you know any woman group? Do you know any women group? Do you know any woman out there? Do you have colleagues that are women? Share, so that they'll be able to have this insight and knowledge ahead of time. And I'm also pleading with us to also begin to educate and begin to allow younger women to have this information. I met a woman who ran away from her husband's house. In fact, the husband himself even talked. He said, I don't even know what is wrong with my wife. She doesn't even know what was wrong with her, because they had gone from hospital to hospital, and they will do all sorts of tests. They're not really seeing all those things in microscope, but yet what is happening to her is happening to her. Some women will come up with the fact that their bodies are changing so much they don't even understand themselves. So that brings me to the fact to ask, what is menopause? Menopause is that time in your life when you stop having your monthly periods, and this marks the natural end of the reproductive stage of your life, and your ovaries no longer have eggs to release. In fact, most women experience menopause between the ages of 45 to 60 years old, and the average menopausal stage is for 51. That's the average, and it can be reached when you have gone 12 calendar months without seeing your period at all. Okay, and some women actually experience early menopause, like I said, due to some health conditions such as primary ovarian insufficiency, where ovaries stop working normally. And menopause can also occur after surgery or removal of your ovaries or your uterus, or when some people are going through some kind of cancer treatment, they can actually enter menopause prematurely. And every woman experiences menopause differently, and that is a problem that the doctors and the medical personnel are having, being able to trace, to say, okay, this is what is it, because every woman comes with her own story, different stories, just like pregnancy. Every woman will tell you their own pregnancy story. Even the same woman can have different stories for each pregnancy, and that's also how, when we talk about our menstrual cycle, we have different stories telling. So each woman experiences the menopause differently, and many may feel only minor discomfort. There are people who don't even know when they've passed through all these stages that we are talking about, but there are some people that have very severe symptoms that their whole lives are turned upside down. So menopause symptoms are usually temporary, but sometimes they last several years. Okay, just like I said, it's just different from one woman to the other. Hello, Nonye, Getty, you're welcome. So what are the menopausal symptoms? Okay, I've already done 70 symptoms of menopause. in a video of just 1 hour. It's a fantastic video. In fact, when I took off, I didn't know I would be able to go through those 70 symptoms in less than 1 hour or about 1 hour. It's a video you must watch. And if you want the link to that video, you can chat me up on my WhatsApp number. I'm going to put my WhatsApp number now for you. My WhatsApp number is +234 +234 703 515 1642 +234 703 515 1642. Okay, so I can give you the link. Or if you're also very, very techy, you can just go on Facebook, just Facebook generally. You can just go on Facebook generally, and what do? You will just put aging with grace 70 symptoms. You're going to get that video out. Okay, you need to watch that video if you've not watched it. But anyway, every woman, like I said, experiences menopause differently, but the symptoms may include your menstrual cycle would become, to fluctuate. It will change. Your monthly period may become either less frequent or more frequent, and then it can also, the flow can actually also change. It can become very heavy, and then it can also be very light. Then hot flushes, night sweats, sudden feeling of warmth in the neck, your chest, and then changes in your heart rate and tiredness. And sometimes some people also have palpitations. Another problem or symptom of menopause is insomnia, having problems sleeping. You can actually wake up with lower energy instead of feeling very, very, strong as you're waking up tired. Muscle changes like joint pains, cartilage changes, osteoporosis, lower density of your bones, okay? Vaginal and urinary symptoms like vaginal lining becoming thinner and drier, and then you experience discomfort during sex, and then you also need, when you urinate, you need to go more frequently, and sometimes you're just there, nothing is coming out. And then another broad one is mood changes. You feel anxious, you feel irritated, you feel upset, you feel sad, you feel angry, and you have more situations like aches and pains all over your system. I've already handled all these symptoms. You can go and watch the symptoms specifically, but the symptoms often emerge before your period stops. So symptoms may be very severe in some women, that even some people have to go through surgery and some kind of treatments, okay? And women from different cultures, okay, and races also experience this menopause differently. For example, hot flushes and night sweats are more common in women in Western culture, while Asian women have more aches and pains, insomnia, and mood changes. And for those of us in Black Africa, because of our heat in our area, we also have a lot of hot flushes, and we also have a lot of problem with our bones, okay, in the Black races in Africa like that, okay? So when we talk about causes of menopause, now let's look at them. There are the natural causes of menopause, which occur naturally when a woman's ovaries no longer have any eggs to release, and its symptoms are caused by a drop in the level of the hormone estrogen. And this can lead up to natural menopause. Hormonal levels can swing from high to low, from low to high, and then your body transitions. This is the period we call the perimenopause, and it can be natural, okay? Natural perimenopause. Now, that is natural doesn't mean you should just fold your hands and just be watching the natural symptoms going on, because like I said, there are after effects when they are not well managed. But again, we also have what we call the early menopause. And early or premature menopause can occur due to, like I said before, medical treatments that stop ovaries from functioning, such as chemotherapy or radiotherapy for people who have cancers. Surgery that make one's ovary to be removed, okay, or in case they are trying to prevent or treat ovarian cancers or breast cancers. They sometimes remove the ovaries of women. And then surgeries to remove the uterus, which is hysterectomy, is also some cases of primary ovarian insufficiency, for example, due to certain genetic, autoimmune, and metabolic conditions. Thank you for the thumbs up. Hello, Kiri, you're welcome. Ibinosa Ize, you're welcome. Thank you for joining me this evening, okay? All right, so there are also unknown causes, okay? Like they say, 6 out of 10 women with early menopause don't even know why it's happening to them. Now, there are people who have been taking some medications that would have caused all those hormonal changes without their knowing it. Some people also, it's the kind of food they are eating. But science cannot pinpoint this. Like I said, a lot of women go through so many changes that they are so different that one cannot handle them. Hello, thank you. Sarah is here. Immediately I saw the big heart. I knew that Sarah is here. Hello, Sarah. How are you? Thank you for the flower. Thank you for the love. Thank you for the embrace. I so appreciate. Okay. All right. So, like I said, 6 out of 10 women don't really know why they are having it. Now, how is menopause diagnosed? There isn't specific tests for menopause. Okay. Your doctor will help you determine if you're a menopausal based on how frequent your period are, what symptoms you are experiencing. Menopause is only confirmed 12 months after your last period. Blood tests are unlikely to accurately actually predict menopause, okay? So you need to seek medical advice, go through, and actually if you read a lot and watch a lot of my videos, you will also be able to determine if and what is happening to you. Good afternoon, Sarah. Okay, now when we talk about treatments, natural remedies for menopause and things like that, most women can manage mild menopause symptoms without any medication. Okay, lifestyle changes, if you're having them mild, there are people who just have mild hot flushes, mild mood changes, mild irritability, mild, here and there. You can actually use your change in food diet. I also have a book that deals with menopause. You can chat me. My WhatsApp number is also there. If yours is very mild, you can read some of my books and you will just be okay. You'll be able to handle that. You can chat me on my WhatsApp number +234-703-515-1642 so that you'll be able to get those books and actually read them very well. And again, usually I also tell people, you don't wait to treat. You can prevent, because prevention is cheaper, safer, and surer and better than cure. Okay, so you can go on some natural supplements that can actually help stabilize and boost your estrogen level by giving you cytostrogen. Cytostrogen is plant-based estrogen that mimics the natural estrogen. So when you take enough of it, it's going to actually allow your system, your hormonal balances to become okay, and you won't go through it. Like one woman was asking me, I said, look, I wish I knew what I know now, even while I was in my 30s. Believe you me, I would have done something, even though I know that when I was still about 30, 40, my gynecologist called me and she said, Mommy Joshua, they called me the name of my second son because that's the one I started having in Lagos. She said, please go and get calcium. So I said, why? So he tried to explain some things. Then I didn't really know much. He said, you've lost a lot of blood. You've lost a lot of your estrogen level. All those words he was using, I didn't even understand them. He said, go and get a calcium with vitamin D so that you will not go through osteoporosis and arthritis. I know he warned me about this. He said a lot of women have handled, by the time they reach their menopause, they have this problem. So he told me then about calcium with vitamin D, and this is one fantastic calcium with vitamin D. But along the line, when my symptoms started, I had to go straight to take some of these supplements. Like I started my Vitalized Women, Royal Jelly, and Multimaca. Okay, I've removed Multimaca from my table because I don't, okay, right, it's even a full one. So Multimaca, okay, these three plus your calcium, very, very fantastic, that can help you if you're just looking at your body being stable. Okay, so this will give you cytostrogen. This is an anti-aging royal jelly that makes you keep looking young, and Multimaca, of course, helps you in the other room and also helps you with your estrogen level. Okay, but if you're like someone, I don't like taking so many tablets, you can go on some of our liquid that can actually help you. We have our Super Green. Super Green can also give you cytostrogen, light ultra, either the chocolate, especially the chocolate brand, can also give you your cytostrogen also that you need. Okay, and these are for those who want prevention and those who are having some kind of mild symptoms that can help them. There are so many other things like for anti-aging, for those who are having flabby skins, those who are having wrinkles. This is also very, very good. Infinite Feminine Complex. A lot of people are thanking me for this already. In fact, a woman got two for herself after using it for the last 2 months. She was like, what? I can't believe, even my colleagues are already commending me. And she just bought 3 bottles last week for herself. She said, by the time I take this for 6 months, I know I'm going to change. All right, so there are also some prescribed treatments from like menopausal hormone therapy, okay, or hormone replacement therapy, which involves replacing your hormones, estrogen and progesterone, and sometimes even your testosterone, to relieve menopausal symptoms. It is an effective treatment for hot flushes, sweat, night sweat, mood swings, irritability, insomnia, joint aches, and vaginal dryness. But the issue is that in recent comprehensive reviews of MHT, which is the menopausal hormonal therapy, it has shown that many women can actually also have some kind of other symptoms coming from it. So you need to talk with your doctors, find out the after effect, find out the side effects of hormone replacement therapy before you go into it. That's what I advise women. I don't want to talk so much about that because that your doctors will tell you that. But like I said, there are also other conditions that may rule out all these menopausal hormonal therapies, which is like if you have like undiagnosed vaginal bleeding, untreated thickening of your uterine lining, unmanaged high blood pressure, current thrombosis such as deep vein thrombosis, okay, or conditions that increase your risk of blood clot, coronary heart disease, strokes and dementia. You just have to be sure if you're okay to go through hormonal replacement therapy. That one is pure medical thing that you need to meet your doctors and actually discuss very, very well with them, okay? So that you'll be able to know if you go through it. I've had a few women, especially those in Europe country, who called me to tell me, oh, by the time they did this, they were having side effects. What do they do? I always tell them, go back to your doctor so that they'll know what to do. But for me, I know that if I start on time and I'm very, very religious about taking my supplements, I wouldn't advise for that. But some people have that sudden symptoms that are so shaky that they are not even able to wait for like 3 weeks, 1 month, 2 months for the supplements to go deep into their system and give their body what it needs to heal itself. Okay, so know what is good for you and make sure you start doing something. Okay, Naomi says, what make those drugs? Okay, they are supplements. Okay, what I've shown you are supplements I have used for 8-10 years, and they are fantastic, no side effects, 100% natural, 100% organic, all made from natural roots, natural leaves, natural stems of trees. Incidentally, I've gone to where they produce their Forever Living products. I've gone to where we produce this, and of course, they are going at very good discount rate. Just chat me on my WhatsApp number +234, which is also pinned there, +234 703-515-1642. Okay, like I said, there are also complementary treatments. Okay, many women try no hormonal options to manage menopausal something, such as if you want to manage hot flushes, night sweats. There are so many options. Like I said, these two combination, Vitalize Women and Multi-Marker, fantastic herbal remedies. They are made from they are made from all the vitamins and minerals that you're very, very well, okay, that can actually help to give you that plant-based estrogen, which are so it's a very, very good. And remember, is very, very good because the light ultra chocolate now gives you that dark chocolate oxidative, that removes all the oxidative stress for you. Okay, and this supplement will also help with your cognitive behavior. It will also help with your mindfulness, the behavior. And also, when we talk about other therapies you can use, some people use mindful and positive confession that can help them because of those who are having these issues with their anxiety and things like that. Aging and healthy aging with Annie, that's one of my mentoring. Yeah, and thank you for joining. you for joining. All right. Okay, so about now, me add me on my number because I'm calling it from this, so I don't call prices. I can't call out in euro, in rands, and things like that, and naira. Okay, so if you chat me, I know where you're calling in from, and then I'll have a personal chat with you to tell you what you need. All right. Yes, Aisha, where are you? I can send it to you anywhere in the world. So can you send them to me on here? I can send them to you anywhere you are. Just chat me on my WhatsApp number +2347035151642, and I'll know where you are, and I'll tell you how you can get it wherever you are. Uche, thank you, super. Thank you for joining me. Okay, all right. Now, like I said, some people will go through a menopausal hormone therapy that is between you and your medical doctor. But like I said, prevention is better, safer, and cheaper than cure. And if you're already having it and you're patient enough to go through some natural remedies that have no side effects, that is what I actually advise people. And like I talked about, deep breathing can actually help you. Mindfulness, confession, and things like that can help you. Hello, Magdalene. Welcome. Hello, hello. Hey, Mama Pastor Ruth Iwunze is live here with me today. Good morning, all the way from USA. Love you, Ma. How are you? That's my good friend online with me today. Thank you for joining me, and also my downline. Okay, I have super women that are with me on this journey. Okay, so if you're living with menopause, there are lifestyle changes to help ease the symptoms of menopause. Number one, avoid caffeine, avoid alcohol, don't take too much of spicy food. You see, even though I came back with plenty of spices from Morocco, I just take pinches and pinches of them so that they'll be able to do their work. I'm someone that loves very hot food, okay? But when I started having hot flushes, I had to cut down on those because when they are hot, they are also helping to bring all those hot flushes to you. So you need to cut down on hot spicy food if you to reduce hot flushes. Okay. Then some people also go about with all these mobile fans. You see, women, even men now, andropause, men who are going through andropause, they still have hot flushes. Do you know? You know that men can have hot flushes. Okay, so they go about with their man. I saw one man over the weekend. He was always with. I was like, oh, hot flushes. Then, of course, I've already talked about some of the things you can do, that you need to dress in layers, okay? So that if you dress in layers to work or when you're going out, if you start feeling cold, you reduce some of the, start feeling hot, you reduce some of the layers. If you start feeling cold, you add up the layers again. And then another wonderful therapy, natural therapy, is exercise. Getting regular exercise will help your mood, especially for those who have mood issues. It's also going to help with some of those symptoms. Of course, you know, when you're exercising very well, your bones are stronger, so you're going to reduce osteoporosis and some of arthritis issues that you might actually also have. Okay, all right. Then, so when we talk about complications, I want to go through complications. Remember, that's what it is for today. What are the complications that come after effect of menopause? Now, it's not as if they wait for your perimenopause to stop before they come. Some, if you don't manage them while you're still during your perimenopause, you will begin to have those symptoms, okay? You begin to have those complications. But some people, it's when they just allow them to enter that menopause, when the estrogen level cannot even come up again, then the things will strike. But God will keep us safe in the name of Jesus, okay? One complication is heart disease. And one important thing to know is that the risk of heart disease increases after menopause. So postmenopausal women are even more likely than men to have a heart attack. Also, estrogen level drops typically during menopause, and this decline has been linked to irregular heartbeat or heart palpitations. We need to be very, very careful if you're having heart palpitations. If you feel like your heart beating more rapidly than normal, make sure you do something about it. If it's you, those of you that have already visited your doctors and you've been given medications about it, make sure you take those medications. And if you've not visited your doctor and you need to go and visit your doctor, but we have one supplement that is also very, very good that has worked for people. Oh, it's not on my table. It's called Cardio Health. Oh wow, my cardio health is not on the table today. It's called cardio health. In fact, me, I don't joke with my cardio health. I always make sure because I'm taking it for prevention. And incidentally, why cardio health? Because it has CoQ10. Also, multi-marker has CoQ10, okay, embedded in it. So people who are already younger and already on multi-marker, they are sure. But if you're having serious cardio palpitation, cardio health can help you arrest it. I have like 3, 4 customers, in Ireland, and it's because one woman was having very serious palpitation, and I said, just take your cardio health, okay? So she took 2 sachets of cardio health, one in the morning, one in the night, and the thing just stopped. So she just started taking cardio health, and she's now telling her friends that are having the same issue, okay? Also, there are ways to reduce your risk of heart disease. Adopting healthy lifestyle habits is very, very important, and it's better you adopt it early enough and continue with it. Like for people who are smoking, whether you're a primary smoker or a secondary smoker, disease from it. When I say secondary smoker, maybe your husband is smoking, maybe your guy in the office is smoking, please avoid them when they're taking those smokes, and make sure the smokes are out of the air before you go in. Because if not, taking the bad part of the smoke more than the person who is smoking well did. Then eating a healthy heart diet filled the whole grain foods, very, very important. I have books that talk about healthy hearts. I have a fantastic book that will show you all the food you need to eat if you want to have a healthy heart, okay? So whole grains, fruits, vegetables, strong defense against problem if you're having any issues with heart problem. Then the second complication is osteoporosis. Osteoporosis is the declining, the decline in your estrogen not only affects your heart health, but it also puts many postmenopausal women in the risk of developing osteoporosis. Remember, I told you already what my gynecologist told me some 20, 30 years back. Okay, he told me go on calcium if you don't want osteoporosis, and I thank God that my bones are very, very good also. Estrogen is important to new bone production because it supports osteoblasts, which is the bone producing cells. So without estrogen, osteoblasts can't produce enough new bone. Eventually, the effect of osteoclast, that is bone absorbing cells, can weaken your bones, okay? So the greatest complication associated with osteoporosis are fractures, which might occur even more often in the hip, in your wrist, and in your spine. So when you are having osteoporosis, which is a decline in your bone density, you run the risk of having waist issues. You see some women who say, oh, they say I should come for waist whatever, and then your spine and also your wrist. Find some women when they are carrying some loads, they are having before you know it, the wrists are twisted and then it begins to pay them. They don't even know what and why it's so. Hello, Ngozi Ara, you're welcome. Nyafo Safad, well done, thank you. All right, somebody's asking a question. Throw in your questions as I see them. I'm going to be answering them, okay? All right. Shepney says, man, how do we go about dryness, total loss in interest on intimacy? All right. Okay, so if you're having total dryness, it's absolutely important that you treat it. You know that your home is very important. Number one, I always talk about natural lubricant. You can see 2 bottles. This one is like it's a full one. I just brought it out. This is one tube I don't joke with, okay? This is an empty one I just finished. I just brought this out. These are natural lubricants. They are called aloe jelly and they are water soluble. So they are absolutely important for you. So you can use this. This is very, very good, especially if you're having your bath, after having your bath, and then morning, night, and then just before, your intimacy, you can use this. And also multi-marker and royal jelly, very, very good. And you can actually add vitalized women. You're going to start enjoying yourself back, okay? So chat me on my WhatsApp number, +2347035151642. Let me know where you're coming in from, Makana, so that I'll be able to give you the prices with some discounts on them. All right, Magdalene says, I'm 50 years, menstrual comes heavy, and a day before menstrual, I have this unbearable pain on my left hand, low abdomen. Okay, that you're at 50, if you're having heavy flow like this, I believe it's perimenopausal. So these two will actually do you good. Multi-mocha and vitalized women, that will be very good for you. Okay, and if also say I have knees, wrist issues. All right, if you're having knees and wrist issues, it's good for you to start on time to begin to do something about them. And we have our powerful twin, which is Forever Move and Active HA. Oh, yeah, help me find Forever Move and Active HA on this table. Have they removed it completely? Forever Move Active HA will actually do you very good, and of course your calcium to also build up your bones will actually also help you to do you good. So we have a Forever Move. They removed it from my table already. It's not here. The Forever Move and Active HA. Enter this room and get it for me. The small carton is Active HA. The big carton down, second to the last is Forever Move. You will just get it from me, okay? So I'll show you that. My WhatsApp number, okay, my WhatsApp number is +234-703-515-1642. That's my WhatsApp number, which is also pinned on the screen here. So like I talk about osteoporosis, I say if you're having osteoporosis, it can lead to fracture, and especially on your hip, on your wrist, on your spine, okay? And they can pose serious problems, especially if you have one at an older age. It's very, very bad, because sometimes when you get so old, operations are ruled out, and they've already degenerated so much that it cannot be helped. And that's why it's good for you to note your body and start on time to do something about it, okay? Your body is less able to recover when you're much older. So you need to do something about it now. So there are ways to reduce your osteoporosis risk. Like I've said before, regular exercises, healthy diet, which are rich in calcium and vitamin D. And that's why this calcium supplement, I have people who buy it in 3s, in 4s. Very, very good for you. Start on time. Like I told you, my gynecologist told me, start on time to take your calcium, and take calcium that already combines vitamin D, because vitamin D helps with the digestion of calcium, okay? So that's why this is the best calcium supplement you can have. And again, your Forever Move and your Active HA, fantastic pair. Synergetically, we help remove most of your pains and aches on your joints, your cartilage and things like that, okay? All right, now again, another complication that comes with menopause is urinary problems. Okay? All right, Clifton says, I have knee pains in both my knees, and I also have back pains and my both sides pains. How can you help? Asking for my wife. Okay, sir. Please chat me on my WhatsApp number. She will need this pair, okay? No matter where she is in the world, we are able to get it to you there. And they are still going on their 25% discount since 2021. I've actually given just these two. Others are either going at 10-15%, but just these two, because I want people out of pain, okay? You can chat me on my WhatsApp number. It's there, +234-703-515-1642. All right, Madeline says, I'm viewing from USA. How can I get those? You can get them in USA. I'm going to give you a discount link, okay? I have my online shop in US, UK, Canada, and European countries. I'll give you my discount link, and you'll be able to buy it, and it will be delivered straight to your doorpost. So chat me on my WhatsApp number, +234-703-515-1642. I'm too fast. Okay, I'm too fast in calling the number. I've already put it down, but the number is yeah, okay. Yeah, the number is also on the screen, the two numbers, okay? There is also on the screen, and then it's on the comment section also. I've also pinned it on the comment section. +234-703-515-1642. +234-703-515-1642. Okay, all right, so that's it. I think I've answered all the questions. Adeshola, Tina, okay. You always have muscle cramps, okay? If you're having muscle cramps, you can go on, you need some kind of better blood flow, and then you also need things that can help your joints fluid, okay? So you can go on Active C and Active HA, okay? These two will help you if you're having muscle cramps. Okay. Clinton says, thank you, thank you, thank you, thank you. All right. From Trinidad and Tobago. Hey, how are you? God bless you. All right. So the number 3 complication is urinary problem. Urinary incontinence, which is the occasional and involuntary release of urine, okay, is common in aging women. I know an elderly woman that called me, especially those who have passed menopause, who are in their postmenopausal stage, and she told me what was happening to her. So I gave her 3 fast clues that could help her. Number 1, Kegel exercises. Doing Kegel exercises will help strengthen the muscles that help with urine flow. Okay, so when you do Kegel exercises, it strengthens it. Then number 2, I advise her, I say go and get Vitalized Women. Fantastic in helping with your urinary control. Okay, because the decline in estrogen causes the vaginal tissue and lining of your utera, that is the tube that connects the bladder to the outside of the body, to thin out and also lose elasticity. As a result, you may experience an uncontrollable urine leakage, and this often occurs during sudden movements such as laughing or coughing, or sometimes when you're just pressed before you get to the toilet, you find out that your pants are already wet. So Vitalized Women Kegel exercises can help you. And again, quitting smoking, and if you're overweight or obese, reducing your weight will also help to manage your urinary problems. But don't hesitate, of course, to talk to your doctors so that they can also do some tests, because sometimes there are some kind of infection that could actually also cause urinary incontinence. Okay, then the 4th problem or complication, remember we have talked about 3 now, 4. The first one I talked about was heart disease. The second was osteoporosis. The third one, urinary problem. And then the 4th one is weight gain. Okay. You just find out you're gaining weight without knowing what is happening to you. And for a few other percentage of women, it is losing weight. They just find out that they are losing weight without understanding. Many women actually experience weight gain as they reach ages 40s and 50s, okay? And this may be due to natural process of aging, and not only just because of menopause, because with age, it's harder to maintain muscle mass. Lower muscle mass slows down your metabolism, and it's easier to gain weight. And that's why you need to boost up your metabolism. Now, for those of you who have natural decline in metabolism, we have our bee pollen. Bee pollen will help. It's a natural bee worker food. You know, the bee worker, what makes them to be very active, okay? That will help to boost your metabolism, okay? All right, now weight gain, particularly around your abdomen, is common in women around the years of menopause. And the increase in abdominal fat is particularly dangerous because it causes visceral fat, and it will push up the risk of heart diseases. And that's why cutting down on your calories, eating nutritious diet, and taking time off to exercise is very, very important for us at this age. I always tell women it's very important. It's not just because of beauty, okay? You know, a lot of women, is because of beauty, they want to remove the fats in their belly part and their midsection. But I tell you, it's more than beauty. Health is even more important, because all those fats are covering your organs, which are very, very important, okay? So when they cover them, they will begin to make them to malfunction. So it's very, very important for you to reduce weight. Healthy lifestyle changes are essential in preventing the great majority of menopausal complications. And so it's very, very important for you to regularly check your body. Like I always say, from age 50, if you do yourself a favor, go for annual checkup. It's very, very good for you. Throughout your menopause, perimenopause period and season, it's very, very good for you to monitor your symptoms carefully and make sure that you transition through menopause in a healthy stage. If you can manage your menopausal symptoms and you're very, very healthy at that period, I tell you, you're going to come out healthier. Even at your postmenopausal stage, you begin to enjoy. So these 4 complications are some of the most important things you need to look out for, so that you don't allow yourself to go haywire. You know what they normally say? They call it old women disease. Now, old women disease can be avoided if you do something about them during your perimenopause, when you're still 35, 45, 55. Okay, by the time you enter 65, you will begin to see all those old women disease coming in here and there if you don't manage yourself very, very well. All right. Okay. So somebody says I have bloated tummy and fluid in the stomach. If you have bloated tummy, you need to work on it. And Pro B and aloe vera gel are for the two pair for very good gut health. This is my own Pro B. You can hear it shaking. I don't joke with my probiotic. Okay. These are the probiotic. They have 6 strains. These are mine. Open Fantastic Probiotic. You If you get them, I'll tell you how to take them. These two will help remove that bloating for people who have bloating, people who have ulcer, people who have digestive issues. Remember that health begins in your colon, and death also begins in the colon. This pair very, very good for your colon. Okay, so briefly, let me just talk about menopause occurs alongside a range of lifestyle and metabolic changes in us women. Okay, and like I said, heart disease is a significant impact on women's risk of getting heart disease from menopause. Osteoporosis, I've already talked about that, because during menopause, your body starts to break down bone tissues more quickly than it replaces it. And I've already told you what to do. And again, another complication, the fifth and the last one for today, is reduction in your libido and your sex drive. Okay. And women usually find their sexual feelings and desire change around this time of menopause. And these changes are very, very common because of drop in estrogen level, and the drop in the estrogen level will also hamper your vaginal walls. Okay, and this can also cause dryness, and some women even just don't even know what they call sex again. So you need to do something about yourself so that you can guide your home very well. And I want to tell us before I leave today, don't remain in silence. Don't die in silence. Don't stay and say, hey, I'm the only one. Oh, you are ashamed. Oh, you don't want to talk about it. You just have to talk about it, because you're not alone. We all have our own part, and many people are talking, and many people are being set free. There is no day I don't handle 3 to 30 women. Okay, I just said 3 to, because sometimes, like today, I just dropped my phone from morning till about 2 p.m. I just say I want to rest. Okay, so don't keep quiet, don't die in silence. Chat me on my WhatsApp number right now, and we'll begin to talk about what to do about you. Hey, Abiodun Janet Ajayi, long time. Oh, how are you? How are you, ma? It's been a while. Thank you for joining me today. All right, Abiodun, you said pain in your knees, right knees, okay? Your Forever Move and Activate are still going on. Very good discount. Okay, like I said, I'm going to stop that discount this year, because dollar is really dealing with us. But you can still get these two at 25% discount for your any joint pains. Okay, osteoarthritis and things like that. And then for the menopausal symptoms we've talked about, these two are a must for those who are still going through perimenopause. And if you've reached postmenopause, you can drop multi-marker and then you go on royal jelly. But if you want anti-aging and menopause, you have to just go with this 4. Okay, so this 4 will help you handle anti-aging and menopause. All right. Good afternoon, lovettes. You just joined now. You can just watch the replay. Jane said prolonged period. These two very, very fantastic for you for prolonged period. Okay. All right. So I'll take more questions in my WhatsApp. You can just chat me on my WhatsApp number +234-703-515-1642, because this video has to be less than 1 hour. We need to go now. Thank you all for joining me. I really, really enjoyed the time I had with us, and you're always there, and I'm always there for you. On Wednesday, I'm coming your way again. We're going to be cooking on Wednesday. I don't know what we're cooking yet, but we are going to be making a healthy diet. I think I'm going to go on some kinds of vegetables for you. some Nigerian vegetables you can have and some dishes you can do. I'm thinking so, okay, that can help boost up your cytostrogen to help your estrogen. Maybe that's what we'll do on Wednesday. And don't forget to go through our Wednesday teaching sort of recipes that you need to learn from. Like last week, somebody called me and said, "Oh, this last week Wednesday is the best." And I think on Wednesday we looked at some foods, snacks that you can have during menopause. Okay, so I showed you some that I have made myself, and I talked about